Evening, Hattiesburg. Thanks for joining us for this Thursday afternoon briefing on COVID-19. Today we will be going over our testing numbers. We will be talking about some specific statistics that relate to ICU utilization. We'll talk about some regional data, some blood drive opportunities, a testing opportunity this Saturday, and of course our regular active courage. Our system-wide numbers, of course, for Forrest General, Merit Health Wesley, Hattiesburg Clinic, and Simrai. As of this morning, 14,808 tests have been conducted. 1,407 of those have come back positive. Again, those are not all active cases, and those are not all in Forrest and LAMAR counties. 12,592 have come back negative. We currently have 754 tests pending. Right now in our two hospitals, Merit Health Wesley and Forrest General, we have 38 patients who have tested positive for COVID. In terms of ICU utilizations, that number has fallen to 13, which is about 3.5 under our 14-day average, which is a promising sign. If we check out our data lines from the first part of April to now, pretty much since the middle of April to now, we've stayed between 35 and 45 in terms of those in the hospital, our two hospitals as a whole. Our ICUs, of course, peaked around May 18th, May 19th. That number has continued to fall off, and now we're at 13, and that's a promising sign as well. Forrest County today added 3 new cases to go to 595. Lamar County added 2 to go to 250. So since the middle of March, we've had 845 people test positive in the metro area for COVID-19. This is our 5-day average, where we look at the number of new positive cases. We average it with the 2 days prior and the 2 days after. Since we've had about 3 days in a row where those numbers have fallen off, we see our 5-day average in Forrest County fall to under 10. Again, these are new positive cases in a given day, which means the whole metro area total has come down as well. So when we talk about recovery numbers, when we factor in the people who have tested positive the last 14 days, we factor in the 39 deaths that we've had in Forrest County. The numbers that are left usually point to the number of folks who have either recovered or survived from COVID unless they're currently in the hospital. 414 in Forrest County, which means in the last 14 days, 142 people have tested positive. And when you factor in that the life cycle of this illness is usually fewer than 14 days. 142 is a good indicator of how many people that we know of are potentially active right now in our community with COVID-19. In Lamar County, that number has fallen to 40 in terms of the number of inside 14 days, which usually tell you how many active cases you have. And you factor in the 5 deaths in Lamar County, that means around 200, 205 have recovered or survived COVID-19. This is a snapshot of each day what the inside 14-day number was, and so we peaked around again that 18th of May. We've continued to fall off. Right now we're under 150 in terms of potentially active cases in Forrest County and under 50 in Lamar County. And if we can keep under those two numbers, that's a promising sign for us. Of course, our overall goals are to protect the vulnerable, people over the age of 60, people with underlying or chronic health conditions. We also want to prevent overrun of the healthcare system by slowing the spread. And as we reopen, we want to make sure that we are continuing to prioritize public health while giving the private sector the space it needs to operate. 4 factors continue to guide our reopening. First of all, the widespread availability of testing. We have benefited this with the opening of C.E. Roy Community Center as a testing site on Monday, Wednesday, Friday from 8 to 4. That will be open again tomorrow. We've also have one available this weekend that we'll tell you about in just a second. The continued wearing of masks, listening to all voices, business and healthcare, but right now we really want to talk about watching our own data. And I want to take a deep dive into the ICU statistics. Right now we have 13 ICU patients, and that average age of those are 62.2. We have people as young as 44, people as old as 78 in our two hospitals. What's more telling is that of those 13 patients, they come from 8 different counties, and that's especially noteworthy when you consider this next slide. In the last 14 days, again, Forrest and Lamar counties don't exist in a vacuum when it comes to COVID-19 because a lot of folks will end up using our two hospitals, which is also capacity for us if we were to have adverse reactions to COVID. In the last 14 days, Jones County has seen a really big increase in the number of cases. They've gone from 422 14 days ago to 701 as of today. That's a 66% increase. 14 days ago, Jones County had fewer cases than Forrest County, and that number, again, has gone up by nearly 300. Wayne County has over tripled their numbers from 72 to 262. That's a 263% increase. And then Covington County, not as many numerically, but a 43% increase nonetheless in the past 14 days. Just to compare, Forrest County had a 28% increase in the last 14 days. Lamar County had a 16% increase. And so what that means when you go back to those numbers is that if these number of new cases, if the people that now have COVID that didn't before have adverse reactions to this, and they end up going to their local healthcare facility, and if their local healthcare facility is overwhelmed, chances are they're coming to Forrest General or Merit Health Wesley for their healthcare. And so that's why it's so important that we continue to make good decisions individually and collectively. Monitoring our regional numbers and preventing overrun of our healthcare system will be an ongoing effort. That means good decision making so that, up until now, we have seen a lot of good decisions being made in our community. A lot of people are wearing masks when they go out. I believe those decisions have lended themselves to us not having as big of an increase as our neighboring counties. And we need to keep that effort up because it's making a difference. And quite frankly, we're going to have to keep our eye on what's going on with our hospitals and our ICUs. To those of you who donated blood yesterday at Main Street United Methodist Church, we say thank you. There was a goal of 15 donors. We had 16. There are 2 other opportunities coming up this weekend for you to donate blood, and they're both at Jackie Dole Sherrill Community Center. The first one is tomorrow from noon to 6. That's Friday at Jackie Dole. That's 220 West Front Street. On Saturday, they'll be there from 7 to 7. And I'll let you know that if you come to give blood at Jackie Dole Sherrill, or if you go to Vital at any time to donate blood, not only will you be donating blood, but they will actually give you a free antibody test for COVID-19, and you'll get that result back within 2 weeks. So again, Friday from noon to 6 and Saturday from 7 to 7, come to Jackie Dole Sherrill. Blood supplies are very low. We need more blood donors. And if you're in the South Lamar County area or in Northern Pearl River County, or you just want to use the drive-through testing service, UMC and the Department of Health will be at Ben Barrett Community Center at 764 East Main Avenue in Lumberton. This is kind of like what happened with Vernon Damer. That drive-through testing opportunity, you do need to use the C-Spire Health app to answer some screening questions, or if you don't have a smartphone, you can call 601-496-7200 and they can screen you by phone. Some non-COVID city news. Of course, we always love seeing when there's new asphalt going down. Today, crews were on Sullivan Drive in Ward 5 in Palmer's Crossing. This is a collaboration between the city and the county. The city gave a donation to the county to pair with the county's funds to get this done. And so for those of you around the Palmer's Crossing area, for those of you who use the Woodall Center at PRCC, I know this is going to be a welcome development in your regular commute. And finally, our act of courage goes to our USM students yesterday. Hundreds showed up to protest the killing of George Floyd. They also were there to share their own stories of racial injustice. And so what we believe is these kind of moments where students and faculty and staff and friends in the community, and no matter what protests you've gone to, sharing your story, having this dialogue, not only solidifies our resolve to make changes, but it also gives us a path forward to move toward a just society for all. Thank you to our Southern Miss students and all the organizations who helped put that on. And as we go into Friday, remember to wash your hands, take care of yourself. Please wear a mask if you go out in public. Do only what is essential, and remember, you are safer at home. Have a great evening.